through poor supplies of health services and commodities during this pandemic, COVID-19. What does this mean in policing bodies? This year, we've seen a lot of struggles going on, multitude of struggles, compounded injustices, and we've seen how the movement in the US pushed for Black Lives Matters. And we also seen that there's been call about systemic injustices that has been neglected by global organizations. And there, and there are also calls for equality between South and North organizations. So today, together, we will explore what does reproductive justice mean to us peoples from the global South, knowing that the framework originated from the US. How do we relate racial, class, power, and gender issues with reproductive justice? How can we organically, as a movement, support reproductive justice? And I would also like to say that this activity is an exploration. We want to frame this session on reproductive justice from our Global South perspective. This is, well, from WGNR, we intend to continue the conversation around this. And like I said, this is just going to be an overview, a snapshot of what reproductive justice mean for us activists from the Global South. And with that, I thank you for taking the time to joining us tonight and this morning for you from other colleagues. And we hope that we have a fruitful conversation today, and let's keep on mobilizing.
Thank you so much, Bean, for that. And thank you for framing the framing session. So we have our three main panelists for today. But the conversation will only be strictly with them because we asked the participants in advance questions that you would like our panelists to address. So we will be asking our panelists the questions that you sent us. We may not have all that, we might be able to address all of those questions, but we'll try to incorporate as much as we could in the discussion. So let's dive right in. We have our first to share is, has a background in midwifery, in medical anthropology, and in public and development management. She has worked in the area of sexual and reproductive justice for over 30 years. Marion Stevens joining us from Sexual and Reproductive Justice Coalition in South Africa to tell us about what is reproductive justice, what does it mean, and why does it matter for the Global South.
Thank you very much for inviting me, and thanks again for the Women's Global Network for Reproductive Justice for highlighting the linkages, the very important linkages today, politically and historically. And I just want to acknowledge our Brazilian compañeras, comrades, as they're waking up this morning, as this framing really does come from a very important historical understanding of freedom and abolishment of slavery and autonomy of people's bodies. And I also want to acknowledge the Women's Global Network, who introduced me to the concept of reproductive justice over 10 years ago when I came to visit in the Philippines. And so to acknowledge Beng and Marlene and Rashita and Dr. Guy for their incredible work in also surfacing this day and popularizing this day. It's incredible how much we've moved in 10 years. So reproductive justice is about power. It used to be about a day of action, a global day of action for safe abortion, but we've kind of contracted it in the world of social media for International Abortion Day. But it really is about justice and action. And it means many things for many people as time has moved on. And so I think that's why it's really important to frame it and to be very clear about the politics of this, because I believe it's been co-opted quite insidiously, and there's a kind of benevolent reproductive justice that's emerging, which is a kind of a little bit of a continuation of sexual and reproductive health, with a little bit extra. And there's a little bit of concern in terms of the uncheckedness of how it's been framed. So reproductive justice, as being kind of started off saying, is about the freedom to choose to have children, and the freedom not to have children. And that's so important with our history of population control. So it's about more than bodily autonomy. It's about what hinders and facilitates the ability to control one's fertility. And also the acknowledgement that fertility does not happen to an individual. It happens within a context. So people come within communities, families, and frameworks, and systems, and communities, and healthcare systems. So what is it that enables or disenables one to be able to support a pregnancy or not? So the issues of class, race, and place are enormously important. And if we look at what justice is, and we've had some 6 months of lockdown and the emergence of the Black Lives Matter, we've had time to think about these and listen very carefully about what is fair and right and what is unjust, and what are the things, the wrongs that need to be corrected. And if one looks at the kind of 4 pillars of justice about distributive justice, who gets it? Who gets what? What is it that is needed to be gotten? Procedurally, how fairly are people treated? Redistributive, what is wrong? What is punished? And restorative, how do you restore to rightness? And so one can see that there are a lot of nuances in that. We've learned about the shortages what punishment is going to be meted out. We've heard the incidences that's happening in the US, but this has been happening in the global south for years, and in particular in South Africa we've had instances of forced sterilization. So in South Africa we've had a history of population control, and actually the legacy still continues. In the anti-apartheid movement, we worked against the controlling and the subverting of Black bodies, while white bodies were protected, were amplified. Numbers of white bodies were wanted. And as a white person in South Africa, this is something that I feel very strongly about and needs to be redressed, and is a continuous project that needs to be voiced. And so that's why the reproductive justice framework, when introduced to our government, works so well, because it is about redress. It's not about rights and health within an individual clinic. It's about redress, and it's about the compounded and interrelated injustices that are systemically understood and experienced. Some people refer to intersectionality as another way of looking at the systemic, interlinked injustices and identities that enable or don't enable women in particular, but not all, to control their fertility. But in South Africa, some 25 years later, in our democracy, we still have enormous challenges. We have got greater inequities. We've got a buffer Black capitalist middle class. We've got corruption, and there's limited accountability. There's a real issue with land still in South Africa. And the most common media story around abortion in South Africa is concealment of birth, where women get access to pills and then have an abortion at home and then have nowhere in a private way to bury their fetuses. And so land is a curious issue in terms of having water and sanitation and some privacy and some land to make sense of what one needs to do. A real concern, and I think that's why it's so important as comrades from the South to be talking, is about the export of US politics that is highlights the kind of white supremacy, individualism, consumerism, and capitalism. And that is visible in some of the international NGOs who practice in our spaces. And there's little investment and sustaining of local NGOs. And there's a kind of extractive politics by international NGOs, particularly US ones, which is very damaging because it doesn't enable local sustainability and our government to function on its own. So you have PhDs being finished in Atlanta to Boston to Hopkins with very little real local investment. And it's a kind of instrumentalizing of people's bodies from the South to represent it at panels or to do things without actually looking at what does this really mean. So in South Africa, we still have 60% of women using Depo-Provera, a contraceptive that was initially used to treat endometrial cancer. It's a lot. And its use has hindered over time a culture of couples being able to negotiate safer sex because it's presumed that women are on contraception. There's still an unclear relationship between HIV acquisition and DMPA. And we also have the implant, which is used. And there's a poor method mix with stockouts and very poor training of health workers. There's very little well thought out information around sexual and reproductive health, reproductive justice. Even over the weekend around, Contraception Day, the messaging that was put out was not accurate. It was not specific. Even doctors really take care in explaining the differences between latex allergies in the female condoms or the internal condoms, the differences between the IUDs, the copper IUD or the hormonal IUD, and what's available in the clinic or not. And the implant is still just pounded as a long-term method without understanding that in South Africa, there are side effects if you're HIV positive on some drugs, if you've got TB, or if you're a large woman, it doesn't really work. And so these are reproductive justice issues because there is not enough thought that's been provided to people in understanding these areas. And then lastly, around abortion today, everybody thinks that South Africa is doing pretty well, but actually only 7% of our facilities in South Africa provide services. Not all health workers are trained. There are no generic medical abortion drugs. Our clinical guidelines are not sorted and published. And abortion is seen as something to be prevented. It's not something that is understood, that is a medical procedure that women will want. 1 in 3 women will need an abortion in their lifetime. And so in this time, telemedicine is an opportunity under COVID. And really, we've seen efforts to demedicalize and for women to be able to look towards controlling their fertility. But as I finish off, I think while in South Africa, our government has embraced reproductive justice, the state needs to continue to implement, and they are obligated to provide services. And we cannot continue to rely on international NGOs and donors to be dictating and providing the specifics of care around sexual and reproductive justice. We have to really look at who is in control, how it's administered, and what women's services on the ground really are. So that's what I'd like to say. Thank you, Teta. Unmute.
Thank you so much, Marian. Marian Stevens would still join us later in the moderated discussion. I asked everyone, we are 35 plus 8 inside the room already, and we are also live in our social media accounts. Marian Stevens will be joining us again later, but we also invite everyone to join the conversation by putting your comments or your questions perhaps in our chat box or in the Q&A function of the Zoom. Thank you. And now next panelist would be talking about the relevance of reproductive justice in positioning safe abortion advocacy and access to medical abortion in the broader struggle for social justices. She has been an activist for sexual and reproductive rights and health since she was 15 years old and based in Mexico. And now she is a member of research at Global South-led Transnational Feminist Alliance and a member also of Vecinas Feministas, a Latin American network of feminists for sexual and reproductive justice. Please help me welcome Oriana Lopez Uribe.
Hi, hello, good morning, Teta, and everyone in the room. I have this question that was related about specifically on medical abortion. So I'm going to be talking a little bit on that, and then a little bit on one of the first things that we need to do in terms of advocacy and access to abortion in general is to unpack what access means. We need to stop making laws in copy-paste. This is something that has been happening in Mexico, for example, that we're just copy-pasting the Mexico City law into other states without really understanding how abortion works or how the context is affecting access to abortion. And regarding to laws, sometimes it's better to erase more than to add words into the penal code, as the US experience has given us those lessons. The more you regulate, the less access you have, and less is more sometimes. Even having the word abortion inside a penal code can mean over-criminalization of those people that a state, a patriarchal state, marginalize the most. That can be the pregnant person herself. We need to address the structural inequalities that make it harder for some and easier for others to access sexual and reproductive health facilities in general. We need to really understand and address the infrastructure issues that hinder women and pregnant people to access information, supplies, and information. Self-managed medical abortion relies on those parts, information and supplies, without having the supplies needed for the medical abortion. It's really hard for people to access safe abortion, especially when it's restricted. Medical abortion has made a revolution in terms of access. In some countries, the main provider of abortions are the feminist networks that provide them the information, the accompaniment, and sometimes even, even the medicines, and therefore the abortion care that is needed. But even when some bridges exist, there's still a need for those who advocate for abortion and those who are providing this kind of accompaniment to talk together and to understand what is happening actually on the ground, what is happening specifically with women and pregnant people. Because those that are working for accompaniment understand perfectly what Marian was referring to as the facilitators or the barriers to sexual reproductive health overall, access to contraceptives overall, but in particular to abortion. In Mexico City, the law allows abortion on demand during the first trimester, even when the choice exists, some kind of choice, because it's still, from a reproductive justice framework, it's not the same choice for everyone. But still, they rely, regardless of the class, regardless of any other issues, people are still relying on feminist organizations and networks to learn about the law and to learn how or where to get an abortion. And with this pandemic in particular, it has been an important and very relevant opportunity to make even more visible how self-managed abortion is, how it is safe, and how it provides a unique way of changing a power relationship. Medical staff is not needed in the first weeks. It's all in the power of the pregnant people. And that is very scary for some people, because that means that we, the people, have the power and we have the right to use it. And that is something that then becomes out of control for the government. And that is scary for them, for the patriarchal state. Self-managed abortion community or ecosystem has made the most accessible materials from images to explain the abortion with pills without words for people that can't read or speak other languages, to translating into native and sign languages, creating books, videos, and even songs. And one of the main things that we have created as a self-managed ecosystem is to provide the testimonies directly from the people that have abortions. That is the voice that we, from a reproductive justice framework, we need to enhance the most. But we also need to unpack what justice means for us and what justice means for us in terms of advocacy. Maybe we're not asking what justice means or looks like for the most marginalized people in your context. Have you asked, or you're just assuming? We sometimes think of justice as a judicial process, but rarely we ask communities what justice means for them or what is expected from the government to give to them. I'm sorry, I have a kitten and it's just annoying. The cases we bring to explain where we stand go for diversity instead of drama from a reproductive justice framework. We talk about adolescents' pregnancies and how we need to give the voice to them themselves, not to their mothers, not to their caregivers, not to their teachers, not to the adult that is coming with them. We need to understand that there is not an automatic abortion to be made when, for example, a people with disabilities has been pregnant or a rape survivor is pregnant. We need to provide people all the information and an enabling environment for them to make their own choice and their decision within their own context. As we know, it's not a matter of a choice that we just have tons of them around us, but we need to provide as many options as we can within our context for everyone. We need to focus more on what people wishes and not on our own paradigm of success. That is something that often happens with adolescents. We think that a teenage pregnancy is not supposed to happen and is not supposed to become a baby. It needs to stop before it hinders this adolescent's life. But we are just focusing on what our paradigm of success is. We're not talking to her and asking her what their dreams are. We need to build that enabling environment for people to fulfill their dreams in their own cosmovision. There are no choices to be made when they are not supported by this context or environment. And we are the ones that are right now building that kind of context or a little bit of a bubble for them. But also in terms of our community, we need to reflect on our own ways of working as a movement to really shift the historical power dynamics. Who has the voice? Are we really building a movement from the root? Are we giving a space, voice, and power to those that have been more disenfranchised historically in our context? That doesn't mean that then we all, with the rest, we leave. We support them, we work together, but we need to check if we're exercising power over others. Thank you.
Thank you so much, Ariana, and everyone's loving the cat, by the way. Thank you so much for sharing that. And now we go to our next panelist who would be sharing more of the situation of safe abortion rights in the region. Dr. Alka Barua is a pediatrician with a doctorate in sociology. She has 30 years of experience in public health. As a researcher, has been involved in formative and implementation in the health sector. So she is with the Common Health, a rights-based multi-state coalition of more than 300 organizations and individuals that advocates for increased access to sexual and reproductive health care and services. Dr. Alka Barua, could you please tell us more about the status of abortion in the region and what has been the experience of working with reproductive justice as a framework in safe abortion rights?
Thank you, Tatum. Good morning, good afternoon, good evening, everyone. This is a critical time for us to be engaged in this discussion, given that access to services in general and reproductive health services, especially abortion services in particular, are at risk. The pandemic, the overwhelmed health systems, particularly in this part of the world, the increasingly hostile global political environment, all are contributing to the risk. And access to reproductive health services does not exist in vacuum. Policy initiatives undertaken at the global level have a significant and grave implication for women's access to services everywhere, particularly the initiatives in the United States of America. We are all aware of the Mexico City policy and the implications of the global gag rule of 2017 that affected the funding available to field level NGOs. And unless they agreed to stop providing abortion related services or advocating for expansion of abortion access, they were not given the funds. And this indirectly sort of limited the access to information and services of abortion in their work areas. Having said that, I would like to focus more on the issues related to access in my part of the world, that is the one I am familiar with, South Asia, and that to within that predominantly India. Now, most South Asian countries are signatories to international agreements to further sexual and reproductive health rights of women, be it CEDAW, Beijing Declaration and Platform for Action, the ICESCR, the Sustainable Development Goals. Many of these countries have also been partners in platforms such as FP 2020, which was meant ostensibly to empower women by investing in rights-based family planning or contraception. And the policies of these countries reflect their articulated commitment to these agreements and platforms. And yet, despite their liberal and inclusive appearance, many have debatable implications. For instance, the programmatic translation of its commitment to FP 2020 in India is a testimony of how these impact women's lived in reality. We have instances of coercion, forced sterilization, insertions of IUCDs, particularly PPIUCDs and PAIUCDs without consent. We have instances of conditional service provision. You get abortion services only if you get agree to get PAIUCD inserted. So this is the context. At the individual country level, we have a range of legal, systemic, social, and individual determinants that have a role to play in access to health services. Most of our countries operate under the penal codes, a legacy of our colonial masters of 19th century. These penal codes criminalize abortion except in case it is needed to save a woman's life or if the pregnancy is a result of criminal offense. Now, these exceptions, again, are not on the grounds of rights, but on the grounds of health. Now, countries like Nepal have promulgated its constitution and has recognized reproductive right as a fundamental right of women. And there are some attempts in India, sort of piecemeal amendments to the existing Medical Termination of Pregnancy Act. But these reforms have such ambiguity in language and the potential for perpetuating stigma, and actually the apprehensions of service providers about criminal liability continue, and that has impacted the availability of services. In these countries, the policies are formulated, in fact, not just these countries, I think it's a global phenomena, that policies are formulated with majority beneficiaries in mind and are exclusionary and often in ambiguous language, mostly with ableist or eugenic approaches to services. And they do not provide the blueprint about how economically disempowered and traditionally subjugated service seekers should go about exercising their reproductive rights. They mention it in the policy, but there is no blueprint or no guideline about how to exercise this. We have forced sterilizations, insertions of IUCDs with consent. We have conditional abortion services. And this is seen more in the rural poor, the Dalits, that's the underprivileged caste in my country. We have instances of forced hysterectomies of girls in remand homes and homes for those with mental illnesses. All these illustrate the gravity of the issue. And all this is further compounded by contradictions between our laws, policies, and programs. For instance, one of our programs promotes confidential need-based sexual and reproductive health services to adolescents. But we have another law, the legal stipulations under that law, which is meant to protect children, makes reporting of any such service seeking mandatory. And that sort of compromises confidentiality. At the health system level, most of these countries in the South Asian part of the world have opted for decentralization. This was to facilitate local decision making. But what has happened is unwittingly, it has resulted in fragmentation in the overall management of the system. As a result, we have unequal availability of services and inconsistent quality of services. at the system level, we have limited availability of trained human resources. We have male service providers for sexual and reproductive health in these conservative societies. We have weak logistic management, irregular supply of commodities and equipments. And in my country, we have implicit targets and method-specific incentives for service provision, which have grave implications for women's choices. At the social level, it's known that the challenges to access are restrictive religious norms, the lack of awareness about own entitlements, the availability of services, myths, misconceptions, stigma, lack of resources, and virtually non-existence of insurance coverage for these reproductive health services. This is despite the fact that there is ample evidence through estimates and real-time data that there is a decline in fertility. But there is also a high unmet need for contraception and fairly high incidence of unintended, unwanted, often mistimed pregnancies. And persons with these pregnancies in the subcontinent do decide to opt for termination. But all these barriers at the policy, legal, and systemic level adversely affect their choices and provide opportunities for conditional exploitative services, more so within the private sector, and push these service seekers to cheaper and mostly unsafe options. So basically, access to good quality services and safe services is a challenge even under normal circumstances, especially for marginalized and vulnerable service seekers. And the current health crisis during this pandemic has led to supply and service disruptions, which has further worsened the situation. Marginalized people's health in my country, at least, has been the first casualty in the war against the pandemic. The agreements our government signs, our policies, and sometimes even our courts in India particularly talk about reproductive autonomy as a core aspect of reproductive justice. There is a lip service to the fact that to achieve this autonomy, every individual, irrespective of religion, caste, sexual orientation, marital situation, existing disabilities, the work they are involved in, such as even sex work, the economic status, despite all this, irrespective of that, they need awareness about own needs, their entitlements, their available services. There should be non-coercive relationships, and they should have access to appropriate services. Now, this is what has been said, but as long as these barriers exist, these legal rights, these policy articulations, these signatures on international agreements are meaningless for those who are seeking their services. These need to be accounted for while formulating policies and programs and talking about reproductive justice. Thank you. Thank you, Tita.
So much, Dr. Alka, for the sharing. Thank you so much for our three panelists for those introduction statements and presentation. At this point, we invite everyone to please tell us if you have any questions. I see two in the question Q&A function. You can also chat, ask your questions, or even your sharing. So I will throw in some more questions that the participants sent in advance to move along with our discussion. We envision this conversation to be sort of a start for further conversation. So we might focus now on the more basics of understanding, because when we did notice that from our participants, they really want to understand and picture how reproductive justice as a framework would actually be experienced or done especially in the global south. So we have a question about from the history of reproductive justice, how does it stand now from its origin, and how has it been interpreted by activists, especially in the global south? Marian, Ariana, or Dr. Alka, if you'd like to share your insights about that question.
So, speaking from South Africa, from my experience, is I was really very fortunate, as I said, in 2010 to understand it from my experience in working with the Women's Global Network, and was able to introduce it to technical advisors within our government. And that then really translated the concept of sexual and reproductive health and rights. And and was enabled a kind of understanding that it's a system, and that it really resonates with the project in South Africa of transformation, of redressing imbalances in the past, of justice, of creating more equity. And it kind of moved away from the kind of North American choice individualist perspective, also noting the concept of power and where people were placed, and that well, mostly women, not all, come within families and communities and contexts. And so it's that really resonated. And at the same time, within South Africa, IPAS was moving out, and we were quite debilitated in terms of the kind of verticalization of HIV services, and the women's movement was kind of very, very, very small. And so we had to build very, very, very slowly, and so much so that kind of just one step after another to move, to get people to embrace this and to understand it. And what has happened now is it's really exploded, and you've got everybody and anybody saying something about reproductive justice, which is slightly concerning because it's almost been consumed as a concept. And I think that's something that we really need to check and be conscious of, and in particular understanding the really important transformation politics that's happening in the US at the moment, where sexual and reproductive justice, sexual and reproductive health organizations are being reckoned with in terms of issues of race, as Black Lives Matter has come, and staff are complaining about leadership and relationships of power in terms of money, how women from the South are being instrumentalized, how things are just not okay, and actually what is really going on here. And are we just being put on a pedestal to be a voice from the South and how we represented, or are we being extracted for your visibility, for your project, or actually are you understanding what's happening here? If you leave us, what will happen? If you go, what will happen? Are our governments going to be able to manage? Are you funding local movements? Will we be able to stand alone? Or is your big donor just wanting to fund another big donor, another group that's actually an American NGO that kind of gives you small change in the South? And this is critical in South Africa because we've really, really seen, everybody was concerned after Trump, like, oh my gosh, we're going to come and invest in South Africa. That has been absolutely awful for us, because what it's meant is you've just kind of leapfrogged from Boston and New York, come to South Africa and taken over without actually looking at local groups and saying, hello, who are you? How can we sit alongside you and listen to you and understand what's going on? So it's been very, very detrimental, actually. And I think this is why these conversations are so important for us to really understand, how do we translate this and what is really happening in terms of ordinary people's lived experiences and how power is located. Thank you.
Ariana?
Yes, I think that in Mexico, from my experience, and I'm probably going to say something that is not very enthusiastic, but I think from my experience working at the beginning on the sexual reproductive health movement rather than a feminist movement or a social justice movement or reproductive justice movement, I think that it was more based on like what happened in the 90s and with the international conferences happening. It was like moving from the demographic and the population control objectives and goals to the reproductive rights. And that was still a language that was talking about rights, but it was phrased as the right to choose in this idea of that, in the right to choose, that for me meant broader, like who to have sex with, when to have sex with, to have sex or not, to what, if you will have children or not, and then how many. And that created for me like a bigger scope. But soon, when the Mexico City law, not the policy, but when the Mexico City abortion city law passed, then all of a sudden the right to choose became like a narrative change that meant abortion. And then all of the other right to choose, like the more comprehensive framework of what a right to choose meant for me, it was just framed as if it was only abortion. And I think that feminism is a little bit of what for me like rescued me from this idea of having abortion as a commodity. And from research and from the Vecinas Feministas, and having a research is a global network based on the South, transnational collaboration. And I think that from there, like understanding how there were similarities across the globe in the global South in terms of inequalities, of the lack of infrastructure, and this kind of pressures from the pressures from outside, from the North, and this kind of like financial flows that were hindering us a little bit from having our own self-determination and reliangness in terms of the program and the implementation of programs. We're just relying on, for example, with the global gag rule and these kind of ideas, and how it just hinders our ability to cope with the needs of our own population, and we just needed to mobilize more. So I think that this is, for me, what reproductive justice means is more a movement than just having a specific goal. Is building a stronger movement. And when we had a reflection with the Vecinas Feministas on what reproductive justice and sexual reproductive justice meant for us in Latin America, it is that it is not, it's a whole thing, and it's linked with economic justice, it's linked with environmental justice, and it's linked with social justice, and all of that impacts on how we have sex and how we decide when to reproduce, or how to reproduce, or if we reproduce or not. And I think we're missing an opportunity when we think that there are things that are happening just because one organization did that, or one person did that. This needs to come from a massive movement, and we need to understand that there's no law that is passing just because one person drafted it. It's coming from people demanding from it in a very passionate way and consistently over decades. And that's how real change is going to happen, only if we just create masses of people understanding how everything is connected and how we need to address the full range of necessities, the full needs of people in terms of sexual and reproductive lives. And not what's happening. I think that it's Loretta Ross' probably worst nightmare, that in Mexico it's happening, that since reproductive justice, it's being like a buzzword, then there are people that are still working from the 90s approach, and no, I'm not gonna say that they're necessarily on population control, but they don't see themselves as part of a larger movement, but they are calling it reproductive justice. They're just putting the words out there, and they're just completely erasing the content of the concept.
Thank you so much, Ryan. I'll get back to you later about the question of who's leading and what are they leading the movements to. Let me just go to Dr. Alka for a while. Dr. Alka, in the region, like how does reproductive justice looks like? Are we able to use it? Is it in terms of the setting in Asia?
Well, actually, I can speak from my experience in my country, India. I mean, reproductive justice as such, the concept does not exist. We talk about justice for specific group or a section of the population, and we have these parallel, ways of addressing their issues. So, we have an act or a law for addressing the needs of people with disabilities. We have something else to deal with those below the party line or those who belong to a particular caste. But the whole thing doesn't come together in terms of, an integrated approach to reach those who are underserved and reached. But the major worrying factors, as you know, India was one which had a major focus on population control in the 80s. After the ICPD, we moved towards reproductive rights, but it seems that with the new government, we are again stepping back. And now, what is very worrying are the three moves that this new government has come up with. One is that it is thinking of bringing in two-child norm. Now, the minute you bring two-child norm for any sort of position that you occupy in the government or any job, you can imagine how it will play out at the community level and who are the people who are likely to be affected. The second thing is our data, despite repeated efforts to address it, is consistently showing a decline in the child sex ratio from 0 to 6 years. And the first casualty of a declining sex ratio is the availability of abortion services, because there is a feeling that sex selective abortions are the major cause for it. And these are happening amongst those particularly who do not want girls or daughters and who don't value daughters. And the third thing, the third move which is coming in is that the government plans to increase the legal age at marriage for girls to 21 years, despite the evidence that, people are having sex at younger age. Now, what this will do is it will criminalize sex before that age of 21, and whatever activity related to that will become a criminal activity offense. So, all this is going to affect, and anything that affects people in India, it affects the marginalized section more. And we don't deal it in a comprehensive fashion. We do not have the concept of reproductive justice in many ways.
So there has been questions sent to us from those who registered about the differences or the nuances of reproductive rights, other frameworks for SRHR. Dr. Alka, what would you say has been more dominant in Asia in terms of the framework that we have been using for especially for safe abortion rights?
Again, from Indian experience, we talk more about reproductive rights than reproductive justice. But if you ask me rationally, if I want something, if I want to do advocacy with the government, given that the conservative governments and right-wing governments are in place in many places, what would be more acceptable to them is likely to be reproductive justice than talking about rights for people. Because the minute you talk about rights, they do not want to give rights. They feel that they are losing control. But if you talk about justice somehow, that is likely to be more acceptable. So that is the right way in which we need to move, is what we feel.
Marian,
sorry.
Marian, Ariana, how would you weigh in that, what Dr. Alka said, like how difficult or how easy would it be using reproductive justice as a framework? In the experience that Dr. Alka said is like dealing with the government, like she said it could be have some more leeway using the justice framework. Would that be true in many contexts?
I think she's spot on. I think that was our experience in South Africa completely, because rights are individuals. That governments feel obligated. You've got to do this. Whereas in the justice lens, really does talk to a very particular ideology, and certainly within South Africa, with the imperative to address our history of apartheid. And the legacy, which is still so pervasive, enormous disparities still, and I think maybe some of the similarities while our presidencies are quite different, with Trump, with what's happening in India, what's happening in Brazil, what's happening in Poland, whatever. These issues are absolutely important in the rise of white supremacy and what that means for population control. And I think as a movement, we've got an enormous responsibility to link hands and link in solidarity to really explore how we can reach out and act and address what the implications are for us in our bodies and being able to control them. What this means for justice, where we are placed, how we are spaced, economic issues, class issues, land issues, climate issues, and the pervasive consumption. I think one of the things that COVID has absolutely taught us is about slowing down, and is about what are we consume and what is essential. So I think the conversation with government continues and changes over time. What the conversation that I had with government over 6 years ago is a very different conversation that I have now. And in February this year, I sat down with policymakers, and we have started drafting a reproductive justice policy at the cabinet level in South Africa, which really looks at the systemic, interrelated issues. But, I am a privileged person advising policy, but I also have direct linkages with people who are members of the SRJC, health workers, activists, sex workers, people within different NGOs, and feeding back into what actually is happening on the ground, and how that actually happens. And so I think that there's enormous benefit and enormous potential to use this framing and understand it and make it. It really has revolutionary potential in addressing how we are located and where power is located. Thanks.
I think that I would like to answer it differently. For me, reproductive health, reproductive rights, and reproductive justice are three things that are different, but they are interacting with each other. For me, reproductive justice means how we're mobilizing as activists. And that means that we're not going to mobilize only for the abortion bill or the abortion decriminalization. We're also going to fight for better conditions, for eradicating inequalities, for providing, providing actual economic justice, social justice in general, and not only about having abortion as a possibility, but also having the possibility to create the families that we want to, with as many children as we want to, or that means from 0 to whatever number you want. And then having the possibility of all of those things happening in the safest way possible, and then that you can become happy. It's just, for me, it's broader than that. We still need someone that is drafting reproductive rights in concrete way in the law and in the policies and in programs. And we're gonna still need facilities that provide sexual and reproductive healthcare. And that for me, it's just a thing that works together as an ecosystem. And it's just, this part is of reproductive justice, it's a movement, and how we see each other, and how are we making clear that we're not here only representing people that look like me, but also representing other people, and how I am also giving space for people that are more disenfranchised than me, and that are able to speak for themselves about their own experiences and about their own needs.
Thank you so much for those thoughts. Before I go with the other questions sent to us, I'd like to read the questions that were sent by our participants at the moment. We have a question here. How best can organizations working in rural areas in the Global South be supported to acquire knowledge in reproductive justice in their countries, to advance advocacy work and passing on safe medical abortion information to the women and girls in their communities? This is from Noel from Kenya. How best organizations working in rural areas can be supported to be capacitated in reproductive justice? Marian, would you like to answer that question?
So thanks for the question. And I think, I imagine that you are sitting with people who are part of your organization and listening to them, and listening to how they're positioned and what enables them and what is hindering them in their life, their access to water and sanitation, their access to transport, their access to safety, their access to housing, education, and how that all then links to their ability to have knowledge about their bodies, have knowledge about accessing health services, and then getting to their fertility, and also considering sexual pleasure and being sex positive. So I think that then one gets to the area of medical abortion as just one area of the continuum of reproductive justice. So I think it's really about sitting and listening, understanding, mapping out with stakeholders, looking at supply chain stocks, working with health providers, working with partners within government, health workers, journalists. Yeah.
Earlier, the question was how reproductive justice is envisioned, or what are the instances and experiences. So I also would like to invite our attendees or participants, if you would like to share your experience of how you were able to use reproductive justice in your work as a framework, or what are your experiences. It could be like best practices or difficulties. Please share, and you can also click raise hand if you want to share or participate in the discussion. Marian, Ariana, Dr. Alka, we actually have this question that really speaks to me, especially with a country where abortion is highly restricted. The question is, in the context where abortion is illegal, because the participant said, from what he understands of RJ as a framework, is that it emphasizes on choice and access. But how can you even use reproductive justice in a context where it is practically everything's illegal, or all services of abortion is illegal? So how do you use that?
I think this is where the medical abortion networks, the feminist networks come in. We most of us live in countries that have signed the Human Rights Declaration, and from them we have freedom of speech, and then we also have the right to access information and the right to access the advancements of science. So from that point of view, and from a justice perspective, we are exercising our conscious mind and our conscience to decide freely that we are providing the information that is out there anyway, that is accessible through internet, because you can access WHO guidelines through internet. We're just translating into more normal language so that we can all understand what it says there, and then how to use medical abortion. I think most of our countries also have misoprostol accessible in drugstores, and even if not, there are some markets that sell it out there. There are also feminist organizations that provide it, and there's also feminist networks that underground make it accessible for people. So I think that there are ways for that to happen, but we just need, as an abortion ecosystem, we need to be able and make sure that we are closing, linking arms ones to each other to support them so they can do that work. That means that we need to understand that medical abortion is safe. We need to stop saying, as part of the abortion movement, we need to stop saying, and the reproductive justice movement, to stop saying that is unsafe for women to use medical abortion on their own, because that is untrue. And there's a lot of evidence that says so. And there's like the WHO guidelines says that to a very bluntly. And I think that it's not only in the early weeks, but I hope that WHO is going to realize how safe it is, even after the first trimester, to use it. If you have no other option in your country, it's safer to use medical abortion than to use anything else. So as we know, abortion is going to happen regardless of the legal framework. So we need to make sure that it's the safest option is available for people. And I think that is one of the things that has been used in most parts of the global south as a very efficient tool, feminist collectives giving accompaniment to people.
Thank you, Ariana. Marian, Dr. Aga, do you want to weigh in that question?
I just want to echo what Ariana said in terms of issues of law. And certainly in South Africa, I think perhaps our law has been a limitation, actually, because it stopped us from organizing and stopped us from finding out where our supplies of misoprostol and mifepristone are and getting those through. So, and I think that in many ways, the opportunity now, 25 years since our law, is around demedicalization and actually telemedicine through getting supplies of mifi and miso in. So I do think that we need to think out of the box in this, and I do think that we're drawing on inspiration from feminist networks in the region. In South Africa, there's an abortion hotline that's going to be launched soon, coming out of the Mama Network, a regional network of feminists networking and organizing, and learning from people where abortion is, the legal provisions are not as progressive as South Africa, actually. And so the nuts and bolts of implementation are actually in training lay providers, in training feminists about how it works. As Ariana says, it's actually feminists that are teaching the WHO that it's actually safe up until 20 weeks, or women are making safe. And also to acknowledge that these were our Brazilian grandmothers that actually discovered how to use medical abortion safely through the treatment of the arthritis drugs. So it's actually a brilliant history that we need to actually appreciate and acknowledge, in how this is women organizing, women on the ground, women sitting together, sharing their stories, women controlling their bodies, understanding how to practice reproductive justice.
You, Dr. Alka?
Uh, well, I agree with whatever has been said till now, but I would like to add to it that another thing which needs to be done is, while all this is happening, there is a need to have an evidence-based advocacy with the policymakers and the law makers consistently about bringing it in, that making abortion legal. That effort should not take a back seat. The two should go hand in hand. That's what I.
Thank you. I would also just like to ask one of the like recurring theme from your sharing, the three of you would be like that used. I think if I'm correct, if I heard it correctly, Marian used the term co-option, and then Oriana said the question, whose voice? So I'd like to throw in again these questions back to you. How is this co-option happening? And Oriana, whose voice is being heard?
In the case of Mexico, I think that at the global level, it is not the voice of those that are most disenfranchised in Mexico, because at the global level we need to speak English. We need to be at places. That means that we have a passport and a visa to get to the U.S. That means that half of Mexicans are not there, right? And then it would be the whitest Mexicans, the ones that are actually able to, one, speak English fluently, but also to get access to the US, because as you know, we're very close, and then we, this migration situation in general. But I'm not gonna dive into that, but that also has to do with reproductive justice. And I think that it is a very challenging place to be, like you have the access, and I'm an activist, but I know that I am not the most disenfranchised of my country. So how do we support others? And I think that this is something that the feminist accompanied the self-managed networks are using more and more and more. This is the testimony, sharing these stories directly from people that are having abortions, all kinds of abortions also. And I was referring to in the first presentation, not only the most dramatic, the most vulnerable, and the most marginalized, but all sorts of abortions. I think that we need to acknowledge that it's not only the most disenfranchised that are having abortions, it's everybody that can get pregnant. It's also valuable to learn that people that are in different classes are having abortions, and they're having abortions for different reasons. And we need to talk about that as well. It's not because they cannot sustain their offspring, it's because they don't wish to. And then we need to talk about that. It is not about only the poor families having abortions. It's also other families, but the poor families also, we need to address the fact that we should all follow our own wishes. And it is not only a thing in the basis of a need because of poverty, or the need because of a rape, or the need because of something else. It's because it's not my wish to become a mother. Or a mother again, or a mother at this moment. So I think that this is something that we need to emphasize a little bit more. And we privileged people need to also be in support of others, but not take a space when we could easily give someone else the voice. We need to be aware of that privilege and then use it wisely, and making sure that we're not exercising our power over other activists or other voices.
Yes, Dr. Alka.
Yeah, I just wanted to add to what I had said in response to the earlier question, that another lobby which needs to be engaged in the whole process is the medical professionals. Unless you involve them actively into this whole fight for justice, reproductive justice, the final service delivery level, where women do get discriminated against or do not have access to services, that is not going to be sorted out on this. And then to a large extent in my country, in India, this is because in medical education, choice, rights, these are issues which are not covered at all. Our medical curriculum is totally so medical centered centric, that, the individual does not exist. So those are the issues that need to be brought in, and the medical lobby needs to be brought in too.
Marian, do you want to add more? All right. Thank you so much. Because I also noticed that in a lot of the questions that were sent to us, many of our participants also want to know, one, how to foster a positive and more effective collaborations from the North-based organizations to those working in the South. And second is, there are questions about how do we actually also ensure that the principles of the reproductive justice are also being implemented, are also being practiced within organizations. So do you want to say anything regarding those issues or those questions?
Sure. I think that for me, it is about self-determination, and it is for both questions. First, regarding to how can Northern foundations, institutions, and organizations can support the global South, and I think that has to do with allowing the global South to self-determine what are our goals, what are our programs, what are our means, and what are our activities, and how is our vision the one that is centered and not their vision. They're not we're not going to be their puppets in terms of they deciding what the objectives and what the goals should be for us. We need to be a little bit more empower and fight back in terms of speak out that we are the experts of our context. And this applies also when we're providing support for others to have abortion or any other reproductive choice, is that person is the expert in their lives. I am not, you are not. It's only that person in particular that knows exactly what her context is, what her situation is, and what her dreams are. And then therefore she's the one that needs to decide how to get and achieve her own dreams. I think that would be exactly the same thing. And I am very concerned about having, for example, goals on the numbers or indicators on the number of abortions that we're providing. And when that comes from the global North, it looks like they don't want brown babies. So we need to make that claim and start saying, like, you need to strengthen the movement. You don't need for us to give you numbers on the amount of abortions, because that cannot be an indicator of success. The indicator of success is people making their own choice, with having options, different options, but not a specific option in particular. Thank you.
Thank you, Ariana. There's also a question about how has reproductive justice as there's a movement taken into consideration also the issues of disability, and how to also promote the conversation between racial justice and abortion rights. Marian, would you like to give your insights about that?
I think Ariana's looking like she's going to talk. I do know about there's the Nairobi Charter in terms of addressing reproductive justice in relation to disability. And I think it's really important that I cannot speak on behalf of the kind of disability sector, but I do think that there's a movement and a grouping that is engaging and speaking about kind of the intersections and make sure that how we address this is inclusive. But I do think that the one point that I wanted to make is around issues of race. And we need to be absolutely clear that we are in a moment where white supremacy and white strong Christian men are getting very strong and are wanting to control the number of brown people. And we're seeing that. And we're also seeing the partnerships with private NGOs and the indicators and numbers and of how our work and how our government's work is measured. And so what is viewed as progress. So we measure in South Africa, our health department measures the numbers of contraceptive devices distributed. And that is viewed as success. We continuously talk about the problem of teenage pregnancy, as opposed to how we frame our language, where we have people, women of different ages, mostly women, with how we talking about it. And we have an academic in South Africa, Prof. McLeod, that has developed a framework called the supportability framework. So we don't talk about unintended or unplanned. That person that is pregnant, that wants to, for whatever reason, not be pregnant, is not supported, is unsupported in being able to continue to have their pregnancy. The kinds of contraception, our budgets for contraception are not visible in South Africa. We cannot measure that. And most of the contraceptive devices are paid for by private donors, actually. And it's kind of almost experimental, you know, so we're having these long-term methods that control women's fertility. Why are we not having modern methods available? And so I think these are really critical issues, certainly from a kind of South African perspective, that we need to keep on our radar. And so often we kind of distracted by other things and have to perform and measure to donors who want a particular measurement of kind of what is so often still called family planning. Why are we talking about family planning when people who use contraceptives are often people who are not planning families? Contraception is also used to treat acne. Contraception is also used to treat endometriosis, to thin the lining of your endometrium. It's used to stop heavy periods. It might even be used for transgender folks to stop some symptoms of gender dysphoria in limiting heavy periods. So I think it's really important that we talk through how these issues are actually quite nuanced in how health is understood and programmed by the North, and what it actually means in our settings.
Thank you. Ariana, you were about to say earlier.
Yes, I was thinking because from research and the Vecinas Feministas and Balance, actually, we have a collaboration campaign. It's called Injusta Justicia, which means unjust justice. And right now the website, it's in Spanish, but it will soon be in English. We have a specific case from Argentina where a teenage girl that had a disability was raped. And the mother requested for an abortion, and the judge granted the abortion, but also said that in order to protect her, they were gonna sterilize her. And they did all of that without Gabriela's consent, the abortion and the sterilization. And I think that for me, I mean, the Unjust Justice campaign is about how teenage are seen as people that don't have any form of consent. And we need to start thinking about that and the evolving capacities of adults and people, but also about people with disabilities. People with disabilities, there's a wide range of disabilities. And we just need to make sure that we explain things better. But it's really rare to find someone at any age or at any disability that cannot understand what is happening if they're pregnant and that cannot like communicate if they're willing to continue the pregnancy or not. So that it should be very specific cases, and not all people with disabilities and not all teenagers that are not, that need someone else to make that decision for them. And I think that, yeah, we need to build a better way of having consent from people, and for us to be better at explaining ourselves. I think that the medical profession is not very, or lawyers in general, I mean, they're not necessarily making an effort for people outside their kind of work, the line of work, that can understand them. And I think that we should demand more of that kind of communication, or facilitators or a social worker that can help with that kind of those kind of cases, because we cannot keep forcing abortions or forcing sterilizations regardless of the issues. And there is a whole disability movement that is like that also demands for the right to abortion, but not from ableism, but rather from a rights perspective, but they are also allowed to have that decision on their own, whichever way, but on their own.
Yeah. Thank you so much. Dr. Aka, would you like to share anything about working with disability rights and safe abortion in particular?
We have a sort of a loose coalition which is working for decriminalization of abortion in India, and we are engaging with a group of people, activists who work on the issue of disability. And it's a very interesting the point of view that they brought in. They said that if you look at the Medical Abortion Termination of Pregnancy Act of India, it treats disabled people as if they are minors. The consent of guardian in many places is required. So you're not even treating them as adults who are capable of taking their own decisions, are capable of making their own choices. So it's something which the system decides. It's not something which has been decided taking after discussions with them or talking to them. So that's the only point I wanted to make. That's the way the system works.
Thank you so much, Dr. Alka. Again, I invite, although we are almost at the end of our conversation, our session today, I still would like to invite all our attendees, if someone would like to share about how were they able to address especially abortion rights issue using the reproductive justice framework, or your experiences, you can raise a hand so we could invite you to share. Okay, let me just before I ask our panelists for the last statements, let me just read some more of the questions that our participants asked. Do you believe that providing children or young girls with more awareness and education could empower them from a young age and probably improve the socio-political situation of women regarding reproductive health? I think I see our panelists like nodding. So I go to the second question here. Such statement as abortion is murder continues to circulate the internet. What are your insights about it? Why is still there proliferation about the idea, the stigma of abortion, given the work that we have done for on reproductive justice? Like very shortly, anyone would like to share? Yes, Oriana?
I didn't say anything, but I think that it is a very strong tool, and that for people that are not familiarized, I think that this is one of the hardest questions at the beginning, like if that's a murder or not. I think that we all know that it is not, but we need to acknowledge that there is there is a factor that has to do with subjectiveness of the person that's pregnant. The person that is pregnant is the one that, through her wishes, can make that fetus or embryo become a baby even before it's born. But when it's an unwanted pregnancy, that kind of connection rarely happens. Therefore, even though it is something that will become a baby, we need to see that depending on the stages of pregnancy, and talk directly to the facts of what is happening in the different parts of pregnancy, and talk without being scared of that. I think that we shouldn't be afraid of talking about that. I think that supporting directly women that are pregnant, they are often asking if that is what is happening. And then when we explain that from a scientific point of view, but also talk to her about her emotions and how does it feel for her, and if she feels like this is a murder, or if she feels like this is giving a better end to this pregnancy right now, or this is a better thing for her own life. And I think that we need to always value her own life over a pregnancy or over everything else. And I think that it's a very clever narrative to change the focus from the person that's pregnant to the embryo. And I think that is where the danger is.
Oriana, yes, Marian?
So I'm curious about your question, because you're saying it's circulating on the internet, and I'm interested in the space of what's happening online and what that means. And for me, who's been around for too many years, this narrative was even before we were organizing on the internet, and would be in face-to-face meetings and discussions and debates with different groups, and usually quite horrible white men. And so I think that what I would encourage you to do is to sit down with some of your older sisters and people in the movement in your country, and to ask questions about how people have organized before, and what people understand, and how they understand that, and to listen to them, and to see how people have disrupted the narrative, and also looking, as Ariana says, the murder focus is on a fetus. That fetus is interrupted, which is the what they are conceptualizing as a murder. It is a loss, it is a reality. But what we are focused on is on the life and health and well-being and autonomy of the woman, and how they find themselves. There are lots of resources online. You're welcome to check out the SRJC website, the Safe Abortion website. I'm sure WGNNR, all our groups have got online resources in terms of questions. But yeah, I just want to say that I think that the internet is a frightening place, and maybe it's not the best place to engage and answer. And I think in preparation, it's always good to sit and listen to people, and to discuss and learn from each other how language is used, what language is used, what works and what doesn't work. Thanks.
Thank you. Interesting to hear. To also, when you said that internet might be the best platform, especially in the current situation where most of us who are doing our advocacy are confined in most of our work and the online right now. It's also very important, I think, to look into and to examine how we are faring in terms of advocacy and using online spaces. We think we've run out of time, but just before we end, I'd like to ask the last question. We've talked about reproductive justice. We've talked about abortion rights. I think as a way to end, I'd like to talk about the other concept that is in the title, which is the Global South. As a last question, I would like to ask, one of the questions that was also sent to us is, what is the distinct contribution of having this South-to-South cooperation or collaboration when it comes to reproductive justice? What's the difference that we can give as South-to-South collaboration?
I'm gonna go for it again. I think that in the US and in other parts of the global north, it's easier to see what are the ones that are most disenfranchised. And I think the global South-to-South cooperation in terms of reproductive justice, it's about learning about what are the most disenfranchised communities between each other, because they look different in each one of our countries. For example, we do not have a caste system like that exists in India. So we don't especially talk about Dalits or this kind of difference in caste, but we do have racial issues, and we have indigenous communities that are most disenfranchised. And we have this kind of colorism instead of racism in terms of, depending on how white you are, then you will have more or less privileges. I mean, if you're whiter, then you will have more privileges. If you're browner, then you will have less privileges. And I think that is something that we need to like see the differences between different countries, within different regions. I think that we share sometimes with the same region. I am guessing maybe Bangladesh, Pakistan, India can share some of the inequalities and understand the historical part of that. And we need to learn that across the regions, and how those systems of oppression work differently in our different regions. I think colorism is not a factor in Africa, but then not mostly of Africa, but then how are the other interactions of social classes, and how that enhances or diminishes. And I think that has also to do with a common goal in terms of colonialism, and how we fight back on colonialism and the oppressions that's coming from the north still, and the financial flows that are still there. Them like, yeah, like how do you say that? But like framing our work and framing our programs.
Thank you, Ariana. Marian, when you see global south, it's still a lot of it's different contexts. They also want to know, are there similarities in our work in terms of reproductive justice? And that's so, how can we like build and support a movement in the global south for reproductive justice?
So just to say, in South Africa and within the region, I do think that race is still an issue. You know, it's very, very pertinent within South Africa. There's still, even though we have a majority Black government, I think that the disproportionate issues of power and access to privilege and access to economic opportunities still is important. But what I want to say about the unique opportunity of us organizing from the Global South is that investment, the US is our major funder in terms of health still in South Africa. Public, but also private foundations. We have enormous investment. That also comes through extractive research and experimentation. We've seen that through a big HIV treatment research industrial complex. And we're seeing that being kind of leapfrogged now, where we are, you know, also doing COVID research. Absolutely necessary research, perhaps, but how it's done and the relationships are so important to understand and to be able to mitigate in terms of the imbalances of power, because it does tend to then be a neocolonial relationship. And even with people of different skin colors. So you might have Black Americans kind of who ostensibly have power, but are instrumentalizing that within a kind of research team. So I think incredibly important to understand that and to address that and to work towards solidarity and understanding of what it means to exercise control, to have autonomy over one's fertility, and to address all these lagging, compounded and injustices that affect one in terms of access to land, access to economic opportunity, access to education, transport, housing. So thank you so much.
Thank you so much, Marian. And I go now to Dr. Alka. Dr. Alka, how do we, like your words, how do we move forward as a movement and ensure that we effectively address all the inequalities that also hinders us from attaining safe abortion rights for all?
Well, I agree with whatever Oriana has said, and in addition to that, perhaps you know, what works in different contexts, if that is shared across the people who are participating in this movement, that would be very useful, particularly in our context. So that's where.
Thank you so much, Dr. Alka. Thank you, Marian and Oriana, in behalf of all the partners for this event from Research, Safe Abortion Advocacy Initiative, Global South Engagement, or SAGE, SHE-X, Sexual and Reproductive Justice Coalition in South Africa, and WGNRR. We thank you so much for joining us in this session on International Safe Abortion Day. And now I would like to call on Garima Shrivastava, Program Manager of ARROW and also part of SAGE, to give us like a closing and a synthesis for today's session.
Thank you, Teta. And thank you, panelists. Can everybody hear me?
Yes.
Yeah, okay. Thank you, panelists, for a very interesting discussion. And I think I speak for everyone when I say that the discussion was really helpful in understanding how reproductive justice allows us for the possibility of broadening our horizons in respect to how we work, and how by centralizing the needs of the most marginalized, it allows us for an analysis of the power structures and the socio-cultural norms on reproductive health. So I'd want to take this moment to thank WJNR for this initiative. And as being said in the beginning, this is just part of a beginning of a series of very interesting South to South conversations that gives us context as well as perspective to the underlying and complex issues that many of us are grappling with in our work. And from SAGE, Safe Abortion Advocacy Initiative, Global South Engagement, and ARROW, we are thrilled to be part of this initiative. Summarizing the discussion, I would just like to echo again that safe abortion access is essential for realizing the full range of human rights and achieving gender, social, reproductive, and economic justice. And this framework helps us in addressing the social realities of inequality, specifically the inequality of opportunities that we have to control our reproductive destiny. To me, one of the most interesting issue that was highlighted in the discussion was how reproductive justice removes abortion from an isolation that we see from other social justice issues, and it brings by the focus on reproductive oppression instead. And as Oriana pointed out, reproductive justice is a movement, and it is connected to the issues of economic justice, of the issues of environment, migrant rights, disability rights, discrimination based on race, class, caste, sexual orientation, and the host of other concerns that we come across. And these issues are directly affecting our decision-making processes as an individual. So on behalf of the whole team that worked to put this discussion together, I would say that we come from an understanding that the lived realities of women from Global South are unique, and the lived experiences need to be centered in the discourses and the policy making processes. And this initiative would help sort of achieve that agenda to some extent. We hope to contribute to keep these conversations ongoing by reflecting our concerns and voices, and while demanding a reproductive justice lent to safe abortion access. For us, it's a political act, an act towards reclaiming our knowledges and epistemologies that have been erased and are often sort of subsumed under the dominant narrative. And we hope to continue these conversations. So thank you, everyone.
Thank you so much, Karima. Thank you, everyone. Thank you for attending, and see you very soon again for another series of discussions for our South to South conversations. Maraming salamat.
Thank you, everyone. That was so great. We picked at 43, I think, but we've had a registration from 54 countries, mind you, but we only had that much in the room. But then I think we've really achieved the oh, we're still live on Facebook, Teta. Could we stop that? Thank you, everyone, and thank you to our partners, She Acts partners who are still here in the room right now. Feliz, everyone in Africa right now. Thank you for joining in, and everyone from Manila as well. Who, by the way, we are so proud to say that today we successfully launched the bill to decriminalize abortion in the Philippines. So it's not impossible in this context to fight for safe abortion services. So yes, I mean, let's just be into that, safe abortion services, but we will eventually be talking about safe abortion rights. But yeah, we're so proud of that. And this one is actually, I mean, we've received also some feedback on Facebook that they've learned a lot. People from Spain, from Guyana commented, and this is really nice. Yes, please remove Garima in the spotlight at this point. So thank you, and we will, for the next session, I really do think that it's not going to be a free-flowing anymore, but we will try and make a program, and really it's going to be a workshop type, and this is still going to be with you guys. I hope you're still going to join us. And we're going to try not to make it in your very, very early morning, Oriana, but I do really think that there's need a lot of follow-up after this. And I do appreciate the fact that it was underscored that reproductive justice is actually about social justice, that it's actually about being part of the broader struggle for social justice. And I think we've achieved that whole objective for tonight, so, and for today. So thank you, and we will get in touch with you with, like I said, a better program for us to be able to continue the conversation. And please also pitch in anything that you want to for us to discuss. And we will email all the attendees for today for have that to have that follow up, because I really do think that they are also the ones that we need to have a conversation with. And it's not going to be a webinar type, but it's going to be a meeting type, so that everyone can speak when they want to and they need to. Yeah, and happy September 28th. Whatever
Yay!
that,
Thank you. For me, it's just starting. Yay!
yes, it's just starting for you. Yes, it's going to be, I mean, our adrenaline is still there. It's still very, very high, but yeah, we've had a long, long, long day, and everything actually went great today. So thank you, Teta. That was also nicely
Sorry,
facilitated.
like the internet crashed just before we start, and we lost all our focus
Oh my.
during the start of it. By the way, we still have our attendees.
Yes, yes,
Yes.
that's why I was talking about the
The
follow.
next steps. Yes.
Right. Thank you so much. So
Thanks
sorry
so
for
much,
technical
Thank
difficulties.
you.
everybody. I'm going to leave now.
Thank you so much, Marion. Thank you.
Thank you. And I
Bye.
was happy that
Bye.
I woke up on time. I'm kidding.
Have your coffee now. I
I
think
already did.
you're a rock star, dear. Thank you so much. Everyone
Thank you,
is.
Ming.
Thank
Thank
you.
you, Teta. Nice to meet you. Ciao, ciao.
Chief, are you there?